Our lungs are critical to providing oxygen to our cells. If they are not functioning properly, a whole host of health problems can follow. Chronic obstructive pulmonary disease, or COPD, is the umbrella term for a collection of different lung diseases. They include chronic bronchitis, emphysema, and chronic obstructive airways disease. Over time, patients with COPD are at an increased risk for developing lung cancer because of existing impairments in lung function. COPD symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. Symptoms can include shortness of breath, wheezing, chest tightness, and chronic coughing, to name a few. Ed Neuzil, board-certified advanced practice registered nurse at the Allergy Sinus and Asthma Family Health Center, talks about COPD and how it's treated.
COPD is more prevalent in men, but we've seen an increase in COPD in women. And so the testing in women to rule out COPD has become more prevalent, so we've recognized it more in women. When we look at different problems like asthma, COPD, emphysema, a lot of what we do here is called spirometry testing. Now, spirometry is when you go into your provider's office and they have you breathe in this machine and they're actually looking for your pulmonary functions. That tells us how much air did you get out, how much did you get out the first second, and then that ratio is how we measure whether you have COPD, you don't have COPD. And so when we look at that ratio, getting below 70%, normal's 80 or above, when it goes below 70%, that's the diagnosis for COPD. That's an obstruction. And one of the big symptoms that you see is shortness of breath, difficulty getting a breath. And although COPD is associated with a history of smoking, smoking is not the only thing that can cause COPD. COPD can be a result of a chronic inflammatory condition. So people that have had asthma early that's untreated can end up with COPD and never smoked before. We also have to understand that asthma causes irritation in the airway, and if we don't resolve the inflammation, then it begins to scar, and scars have a tendency to constrict. So as it constricts, now it reduces the diameter of the airway and result in COPD. So when we look at young people and we detect asthma, it's prudent to really look at the fact that if it's left untreated, we can be developing COPD at later age. We treat asthma in several ways. We start off in this stage effect where we would use a short-acting bronchodilator, and people call that their rescue inhalers. And so those are the people you'll see that they start to have a little asthma-type symptoms. They'll be taken out of their inhaler and they'll shake it, and within a couple minutes they feel better. The next step would be use a steroid type of effect. It's an inhaled steroid. So we would try to add that in because we were just talking about asthma being a disease of inflammation. So we would use an inhaled steroid to help control that. And if we're still having symptoms, then we go into other combination type therapies. So there is a step approach that goes with that. Of course, we try to start with the most mild, but we have to be vigilant in the fact that we don't want to fool ourselves in the fact that this is controlled versus just tolerated. The difference between controlled is you're not having symptoms. Tolerated, you're having symptoms and just don't pay attention to it. Nobody wants to have COPD, but the more they can understand about this disease, even before they have it, the more we can prevent the disease.
For more information or to schedule an appointment at the Allergy, Sinus, and Asthma Family Health Center, just click the Clearing the Air story link icon on our homepage, yourhometownhealth.com.